Bill. New at 11 a.m., putting off a trip to the hospital or emergency room, doctors say that they are seeing a concerning pattern. People are so worried about catching the virus that they're choosing not to go to the hospital when they need it most. NBC Connecticut's Jennifer Joes has more on what doctors want you to know.
Doctors in different ends of Connecticut say they're seeing a dangerous trend. Fewer people coming into the emergency room.
Of the people who are coming in, they tend to be much sicker.
We're finding people that are missing that first golden hour of, heart attacks and stroke care. People are still coming in late with infections, larger abscesses, larger skin infections, urinary infections that go to a kidney infection, things that you can avoid by catching early.
Doctors first noticed this when the pandemic began, but despite their efforts to reassure people that the hospitals are safe, emergency room visits are still down. At Bristol Hospital, it's down about 20%. And Andrew Lim, the medical director of the ER for Bristol Health, says they have fewer COVID patients as well. At Backus Hospital in Norwich, it's the opposite. Dr. Kyle McClaine says they're seeing a surge in COVID patients in eastern Connecticut, but the overall ER volume is still down about 20 to 30 patients a day.
We still wish people would come in sooner. The hospitals are safe. The ERs are safe. People should not be afraid of coming to seek care.
Both doctors say their hospitals have plenty of personal protective equipment. They're sanitizing between patients and keeping the waiting rooms extremely clean.
We test every patient who gets admitted to the hospital, or every patient that has surgery is tested for COVID. So, we're able to quickly identify those who may even be an asymptomatic carrier.
But Bristol Health says if you're still worried about going into the hospital, you should try their telehealth option. Speak with an ER doctor from the comfort of your own home, and from there they can prescribe you medicine or urge you to come in for further treatment.
What we've decided is that when a patient sets up a telehealth visit, if we then recommend that they come into the emergency room for evaluation, we're willing to waive that telehealth fee. So essentially, it's like a free screening.
Their biggest message: don't let the fear of COVID stand in the way of seeking care. In Bristol, Jennifer Joes, NBC Connecticut News.